But welcome everyone for our Ease of Research seminar series. Uh, Today's series, we want to talk about Georgia CTSA. Now, Georgia CTSA is obviously, all of you know, is a very unique resource. We are thankful for those who have managed to provide this resource for us. It's a competitive award to NIH, and it takes a lot to get that. It's also very unique. I've seen CTSAs before. I think our CTSA is extremely unique in how collaborative it's across all different Georgia institutions. But for the investigators of Department of Medicine, CTSA offers sort of a unique place to be able to both look for funding, opportunities, support clinical trials, support for your clinical trials. So, with that goal, we wanted to invite our team members from CTSA to come and talk about some of the CTSA initiatives. So, we have Bridget and Delta with us. Bridget and Delta, if you can introduce yourself, your role in the CTSA or your other roles. And I think today you will be focusing on some very specific areas, which, because I know the whole thing about CTSA is quite big, but we look forward to that. It's a very interactive session, so anybody please, unmute and jump in or put your questions in the chat. So with that, Bridget, you want to get started, or Delta, who is getting
Yeah.
started?
Yes, I can get started. Thank you, Dr. Lama. So good afternoon, everybody. I know it's a Friday afternoon. I just wanted to come here briefly to give you guys some general information on some of the Georgia CTA resources. Again, my name is Bridget Strong. I serve a dual position here at Emory University. I am one of the directors on the grant for the Georgia CTSA, where we oversee a lot of quality and efficiency work. And I will talk about what some of those resources are to aid in that quality and efficiency. And I also serve as the Associate Executive Director in the Emory Clinical Research Office on our Clinical Research Support Services team. I do have a couple of my team members here, and I will let Delta introduce herself because she is one of my team members on the Georgia CTSA side. So take it away, Delta.
So good afternoon. Like she said, my name is Delta Humphries, and I serve as the Clinical Research Navigator for the team. And so I have been in this role for a little over 2 years, I believe. And so I officially moved on the quality and efficiency side back in April, I believe.
All right. Thank you, Delta. So I'm going to go ahead and just get started and share my screen. Are you guys able to see my screen in presentation mode? If somebody can just give me a thumbs up. All right, awesome. So again, I am going to present on our navigational resources today. So just to give you what are some of my discussion points, I will talk about our team and our responsibility, the things that we do with the Georgia CTSA, bring you a little bit of awareness of some of those available resources that we have for investigators. And I will also talk about some of those collaborative efforts as well. As I just mentioned, I serve a dual role here at the university. So I would talk about those collaborative efforts that I have with the office, with the clinical research office on our support services team. Okay. So again, me and Delta just introduced ourselves. We are part of the Georgia CTSA navigation team dealing with quality and efficiency. So let's just talk about our resources. So this team aids in facilitating the flow of your clinical trials here at Emory from the initial approval to the implementation. So basically a good bit of the pre-award approval process is what we're helping with. So we aid and collaborate with investigators on the front end of things, making sure that we can improve the process and the flow of things by either making sure you get education, making sure you get the available resources needed to be able to make sure that this process is seamless. We also manage your clinical data in a system that we call CTAS. It stands for Clinical Trial Automation System, and we track the progress of that during your pre-award process. But now with the implementation of Insight, we are able to actually go inside of Insight and see kind of what is the flow and what's going on. And when those things happen, we actually come in and figure out with the administrative offices, like what are the gaps, what is being held up, is it's something that the study team needs, to be able to facilitate that flow to get you quicker to the approval process. We also maintain an investigator dashboard, and that aids Delta in tracking a lot of the stuff that she's looking at in terms of study approval, seeing where those gaps and delays are so she can be able to, quickly alleviate those issues. So we maintain that. We also manage a lot of electronic guides for research orientation for our investigators and our study team at this university. And we are aiding and identifying those delays and those gaps and trending that information so we can bring that information to leadership and higher ups to kind of rectify some of that. One of the things that we have made a great stride on is implementing Insight because we can quickly see at a glance of what's going on and where it's stuck in the approval process. We do have what is called a RAT card. So let me just show you what that RAT card looks like. And that RAT card is kind of explaining a lot of the things that I'm talking about right now. And so we utilize this card just to give out. It's probably been placed around on campus for your knowledge. And we are working with other collaborators such as Morehouse School of Medicine, Georgia Tech, and University of Georgia when we're doing this navigation. And these services are kind of the things that I was talking about earlier. And I'll get a little bit more into it in just a second. All right, so let's talk about the investigator dashboard. So this dashboard at Emory basically gives faculty and staff a window into what we're doing in the approval process. So it's allowing study teams to just view their information just in time as it relates to their approval process. And like I said, one of the gains that we've been able to do with this investigator dashboard is kind of funnel that same type of method into Insight. So I don't know if you guys have been in Insight or if you've taken your training, because you do have to do training in order to get into Insight. But in Insight, you will be able to see the progress. And let's just show a little bit of sample of that because Insight went live in September. And so now you can see once you get into Insight, definitely from a humans module perspective, you're able to see the progress and the status of things as it relates to your proposal. And so we're looking at those things. And like I said, Delta is tracking just to make sure that we're not hung up anywhere on certain things. So let me just look at one study. I won't go deep into it. I just want to show you guys what we can see that is here in Insight. So as you can see this progression here, we're looking at this. Definitely we're looking at the time period of when it's been submitted, how long it's been in a particular area. And when we see something that's hung up for a long period of time, we may be reaching out to that investigator or that study team member and saying, hey, have you guys been able to do X, Y, and Z? What's kind of the holdup? And like you can see, this was in June of this. So it's supposed to expire in June of next year. So this is a relatively new study, and see, it was just modified actually today. So there's a lot that we pay attention to just to make sure, but going in Insight has made this effort a little bit more seamless. We used to have to do this on an Excel spreadsheet, which was very hard. And then we developed that system that I call CTSA that I spoke about earlier, which is more so of a REDCap electronic data system that we've been using. And now we're able to kind of bundle this a little bit into Insight. And our goals is to start being able to do reports out of here. So when we're talking to investigators, we can quickly show them those issues and those problems that we see that we've been able to collect data on. Yes. I hear somebody saying something, but I didn't quite catch what they were saying. Is everybody able to hear me?
Sorry, my fault, Bridget. I was saying something. And
Okay, I'm sorry.
the wrong.
Yes, Dr. Lama.
So my question for you is, this what you're showing us in the back there is, are you able to see only the studies which have been linked to this navigator? Like, what I'm trying to understand is, if I am starting a clinical study, when will it be considered a part of this? Like, how can I get this help from this navigator, CTSA navigator? Is it like, do I have to, not all clinical studies are in this, right?
Correct, correct. Not all clinical studies in there. And we do have a specific subset of studies that we're looking at. We're looking at like clinical trials specifically as it relates to a lot of this. And I can have Delta to explain a little bit how she receives the information of the studies that she has to look at. So Delta, you can
Excellent.
unmute
Okay.
and just explain how do you become aware of studies that you need to review.
Okay.
So I become aware so if the coordinator submit, say to IRB or they're working with RAS, I come notified via email that a study has been, getting ready to get started. And then that's how I'm able to keep track of like how long it's been in the IRB stage, how long it's been in the financial stage. So I can keep track on that. So I receive the email. So if you have a coordinator submit a study, once all of that is submitted, I start receiving the emails.
And then do you let the investigator and the coordinator know that you are helping them as a part of this Navigator process?
So when it comes to like helping them, most of them that I have worked with in the past have like reached out when they notice delays, and then that's when I can reach out to the departments to see what's the holdup.
Thank you.
You're welcome.
Great questions. And the next thing, so that's the investigator dashboard and how we become aware of your study and being able. So we're kind of working behind the scenes a lot. So we're not constantly in your face bothering you, but when we see problems, we reach out to you. And like Delta just said, if you guys notice problems, y'all end up reaching out to us. But you do have an awareness that we are kind of working with you. So Delta does have an email that goes out to investigators that says, hey, we're reviewing X, Y, and Z. This is the investigator dashboard, blah, blah, blah. It's a particular blurb or a template. So you will know that we are watching, but we're not going to actively, bother you or whatever until we see issues or problems or hangups and delays. And we kind of chime in to kind of help move that along the process. All right. The next resource that we have is the Trial Innovation Network. Part of our grant responsibilities may be changing as it relates to this, simply because of everything that's going on from an administrative perspective and governmental perspective. But we do offer investigators who are dealing with multi-site trials the ability to request an initial consultation. It's like a studio that they do. Dr. Carlton Dampierre, he's a pediatric physician here at Emory. He is the one that oversees these studios, but we kind of aid in making sure we get people to the right person so they can have this consultation. And some of the things in that network features like single IRBs, if you need to do master contract agreements, if you need, some help with your design or your approach of your research, or if you just need to aid in getting recruitment and patient engagement, this innovation network kind of helps with that. And like I said earlier, we have more than just Emory involved. You have Morehouse School of Medicine, Georgia Tech, and University of Georgia. So there are other people who could potentially aid in assisting you with any of these different features here that I have listed. The next resource is our data safety monitoring board. Now, this is something at Emory that we want to develop as our own, like a whole committee here for Emory. But right now, under Georgia CTSA, we offer studio consultations really to give you those resources and support if you want to start a DSMB or if you need somebody to reach out, depending on your contract or your study. It may say you may just need a plan. You may not need to have an initial board. But say if that study does require for you to have a board, we do give you resources of how to go about establishing that board. There is a form that you have to fill out to get that studio consultation. So we can be able to help develop you a board so you can have that for your research study. So again, we're here to help and assist you with being able to establish that board. But we do need volunteers. So a lot of times we don't want to have to hunt and find people to help help you. So if we already had like a committee of people, which we have some, but we got to keep the list updated based off of expertise or different specialties depending on your research, because we want to be able for when you need a board for your study, hey, we could go to these people and say, listen, this is going to be your board for this particular study. So we do need volunteers, and you guys will have this PowerPoint presentation. So all you would have to do is fill out that survey within SurveyMonkey, so we can be able to establish and get information about you so we can aid in developing a board specifically for Emory. Okay. The next resource that we use is one that I think is very, very great, and it was definitely needed during our time of COVID. It's the Rapid Response Team. We call it an RRT. And what this Rapid Response Team is basically an opportunity for that pre-award approval process to go through as an expedited review. So basically we streamline and work with everybody involved, the IRB, Office of Sponsored Programs, Grants and Contracts, the Emory Clinical Research Office, all of the people who need to be involved, conflict of interest, whomever, on the front end to try to get this study approved and ready to go within a quick process. So normally what happens is investigators will fill out this form. Within 24 to 48 hours, we are responding to try to get everybody on board so we can get this study up and running really quick. So of course, as you can imagine, during the COVID time frame, we needed to get studies up pretty quickly. So this can be a turnaround within less than a week sometimes, because everybody is doing what is necessary, even if they're staying up late, to try to get this approval together, the contract done, everything done, so we could get this study out in a time frame. And of course, there is criteria for meeting an RRT. So of course, it has to be high priority, needed an emergency approval. And part of that submission process is we go through that to see if you fit criteria for one of these things. So either a public health emergency, a bioterrorist attack, or some type of significant catastrophic event is the reason why we would go ahead and issue you as a rapid or an RRT into this. So if you guys were not familiar with this process, we do this here at Emory to try to get that study up and running pretty quickly. And within a year time, like COVID, of course, we had plenty within that year, but currently now we may have maybe one or two, maybe three max that may happen within a year. The last time we had one was probably earlier within this year that got through, but it really didn't qualify as one, but we tried to get our best and get that thing open pretty quickly. But we don't get them as much unless we're having these things, and we really don't want these types of things to happen, right? We don't want to buy a terrorist attack. We don't want to have to deal with it because of that reason, but that resource is available for you guys. So let's talk about some combined efforts that we do here at Emory with Georgia CTSA, as well as the Emory Clinical Research Office. So within this, my other team, which is I call it the Clinical Research Support Services, or the CRSS team, we do a plethora of things for the investigators as well as the study teams. So one of the things that we do for investigators is ensure that they get in the education, as well as their team are getting the education, the training, the credentialing, all of the things that they need to get up and started to get moving forward with their study. Working along with Delta, we're able to aid in knowing like where things are maybe hung up. So say, for instance, somebody's hung up in the IRB, right? We've had this happen a lot where people are waiting on the cost option before they even start doing anything else. And we're like, no, you don't wait. We always train people, select number 2. And so it can move on through the IRB. Do not wait to submit to the IRB and all of these other people because you're held up on a cost option. So when we work with Delta and we see that they're hung up, Delta may say to us, hey, Bridget, listen, they are not moving forward because they're hung up in the IRB, and we find out it's the cost option. So an example of that is something that we see quite often. And then there could be other slew things, but we try to aid in helping moving this along pretty quickly. We do provide a lot of concierge type type of support for investigators to ease the burden of them having to get studies up and running. And we do partner with our research administration office, a lot of the Emory schools, Emory Healthcare, and a lot of our affiliates, just to ensure that we're getting things up and running for you so you could be able to start seeing your patients. One of those concierge services that we provide is a PI consultation. I actually have one of my senior consultants on the line, Dr. John Doan. He is one that him and Delta, they both work together as a collaborative effort to, one, let investigators know about the process here at Emory University and what they need to do to start the flow of research and make sure that we don't get caught in some of those gaps. And then Delta talks about the things that she does just to make sure that things do go seamless. So that is a concierge service that we provide to the investigators. Because it's only John, we haven't opened it widespread up to everybody. But Dr. Lama, thank you for sending the people that you send to us. John, I think within this past year or two, has seen over 20 some investigators to be able to help them. And they're not only just in the School of Medicine, they're in School of Public Health, they're in different areas that he helps just to try to guide investigators through. And they are truly, I see all of the evals that come back and they're so appreciative because they had no clue that they got to do all of these things. And I do believe how you start things off also depicts how things are going to end. So if you have all of the information that you need on the front end, how to move this process forward, it will be so much beneficial for you as you move along the process of getting things up and running. And I just added this slide when I was talking to Dr. Lama right before we started, and I did it just that quickly, Dr. Lama, just to talk about another service that we do provide as a concierge service. Currently, right now, this is a pilot project. We're working with the Departments of Human Genetics, Infectious Disease, and two investigators, Dr. David Schuster, who's in radiology, and Dr. Arshad Kayumi, who's in cardiology. Currently, right now, we are piloting what is called the Clinical Research Award Consultation. And what this does, because Delta is doing the front end of things, which is the pre-award approval process, we needed to address the post-award side of things. So when you get in a notice of award on your clinical trial studies, what we do is we come in, have a consult with you and your study team members, making sure you understand the contract that's involved, the payment terms, any coverage analysis to determine, who is paying for things legally or from, a third-party payer standpoint, making sure that your documents are all up to date, making sure we're working with all of the right versions of documents, because you don't want to be able to start seeing your first patient and here you have the incorrect documents in the wrong contract or the wrong consent. So we make sure you're prepared and ready to go before you see your first subject and you know what you need to do along the process. We also ensure that you get your startup money by definitely working with our invoicing team and monitoring that your startup costs have been received and debited into your grant account. And then what we do is we monitor you like every 3 months. Definitely once you get your first patient, we make sure that the billing goes correctly across Emory Healthcare as well as it's debit correctly from your grant account. So if we didn't have any hiccups with that billing, everything should proceed the same exact way moving forward. So that's what we do, and we monitor that almost every 3 months until there is a closeout of your study. And when you close out, then we do what is another consultation meeting, is where we make sure that you have all documents, all finances are together, all queries have been answered to the sponsor. Everything is good and ready to go before you close that out from a site perspective. So again, we start at the beginning to initiate you. Once you get that notice of award, we monitor you and we help you close out. It is a pilot. We have been, we've presented this at our faculty advisory board meeting recently. It was well received. I just presented it to our CFO for the university and a lot of research business office managers recently. It was well received. So hopefully fingers crossed we could get some more support and aid for this to be able to offer this service more to just these people that's in the pilot. We want to be able to offer it to everybody. So that way we don't leave no money on the table. Everything is done. Everything is what it's supposed to be. And if we have to correct within that monitoring period of us reviewing your studies, we're able to do that right then and there and don't have to wait until we get ready to close it out and try to figure out what the heck went on and why we didn't have what we needed to have, right? So that is one of our combined services that we have related to that. So are there any questions? I do know that there was a pre-question, but before I go to that, Delta, this is her contact information here. If you went to the Georgia CTSA website for navigation resources, you will find Delta's contact information there as well. You can always find me in the search directory if you need to talk to me directly. And we're always here to help in any capacity that we can for the university and definitely our investigators. But one of the pre-questions that we have was, how will the Ease of Research initiative reduce administrative burden for investigators and research staff, particularly in areas of IRB submission, contracting, or budgeting? That is a loaded question, but I am going to give you the best answer that I can give you. So we do know there is a lot of burden on the investigators. That's why we have tried to, I have tried to come in to say, hey, working with all of my collaborators, what are some things that you need? So when we found out that, you know, a lot of the investigators did not know what they needed to do if they transferred into the university, if they left the university, or if they were here. So what we decided to do is to collaborate with School of Medicine, School of Public Health, and School of Nursing to make sure that we are in the forefront of either their orientations or their trainings to say, hey, we have somebody here to help you understand all of this. So I'm an advocate of education and training for sure. So I'm going to make sure you have the knowledge first. So I think knowledge is definitely key. It's kind of hard to understand where to start or where to you know, go in this process if you don't understand what it is, right? So I think education is definitely, and knowledge is definitely going to help with alleviating some of the burden. Now with the implementation of Insight, I think things are going to get a lot better. Of course, you know, it's going to be rocky at the very beginning because it's a new system, it's a new initiative, right? But if you looked inside of Insight, you can see where it's beginning to connect everything together in one area. So with the implementation of Insight, it's going to definitely help with all of these things from IRB submission, contracting, and budgeting. And then with the combined other resources that I have, I do think us having someone you can go to that's an expert that you're able to talk to who understands the entire flow of the process. Me and my team, most of us have been in research for 25 plus years. We've done budgeting, contract. Some of us been investigators, some of us been coordinators. We've done project management. I got a really diverse, multifaceted, dynamic team, and I'm super proud of them. So we will be able to help figure out anything that you may have. So having somebody you can go to, I think will aid in alleviating a lot of that as well. So those are the questions I have. Yes.
Thank you. I want to address this a little bit because before we go to Delta, if you go to your last question, you know, because the last question talks about the Ease of Research initiative, which we started approximately a year ago now, a year and a half ago. And the real goal of the Ease of Research initiative was to do exactly what you're trying to do through this program, which is to have a support structure around our investigators.
Mm-hmm.
And I agree with you. The first part of that support structure is also awareness of the resources which are already there. Sometimes we get frustrated. I get frustrated as an investigator with something without realizing that, in fact, there was a resource which I didn't know about and I'm not utilizing.
Mm-hmm.
And I think that's something which this webinar series was supposed to do, was to, you know, we had talks from everybody, from Robert Nobles himself to our IRB director, to our, we have the wonderful talk from Robin about OCR at that time as well. And now we will also get the Woodruff Foundation clinical trials. Don Harvey, we will invite him as well. So we have been doing that. That being said, I think as an individual investigator, you might still feel like, there's nobody to help you. And what you want to tell us, Delta, here is that this research navigator, which is appears to me is a new thing, like this clinical research navigator. How long has it been in place? Can I ask you?
Yeah, it's been in place a long time. Now Delta is new to the role because at one point we had the grant from Georgia CTSA had to be reviewed and renewed. So we had lost funding for a little period of time, but we quickly got it back. And so we had to end up finding new help. And that's why Delta's only been on it for a short period of
But
time. But this process with Georgia CTSA has been in play since 2015, 2014. Robin, can you help me remember the time frame? I do not remember how long it's been, but it's been a while.
It has been a very long time. And I believe it was 2014, 2013. So it's been quite a while. Initially, we had two FTEs. And then as the grant was renewed, we only had one FTE that came back. So we've been trying to be creative on how we still provide support to the research community.
Yeah. Thank you so much, Robin. So yeah, I do think and not that I guess we were hiding, but sometimes until we understand how things best fit in certain things is how people find out about these resources. But that's why we're kind of coming out in the forefront and saying, hey, we're here. We can help you. You just didn't know who we were. And so now you know that who we are, and we're coming out, and like Delta and I were talking about doing road shows, reinitiating those road shows and going to different departments and letting them know about these initiatives, because there is help there for you. But again, she is one person, and then my team of John is one person for the PI investigators consultation. So it hasn't been as widespread as we want it to be due to the limited resources, right? So what we have been doing is going out and talking to like the faculty advisory board and talking to the investigator, the financial CFO and the business officers, and letting them know, hey, this is a need. And if we can invest in this will be so much better. So investigators can have somebody they can go to, an actual SME or expert that's in this field that understands what they're dealing with, so we could be able to get things through a lot quicker. And it does provide a good return on investment for the university, simply because things are going through in a timely frame, and we're not, wasting time on, just because somebody didn't pick the right cost option. We could have alleviated that in one email, So yes, definitely that. Yes, Robin, you have a question?
I just wanted to note that a couple of years ago, they created research navigators in the RAS units. But I think that the volume of work was so great and the backlog was so great that they ended up incorporating them into the daily operations as opposed to working as an actual navigator. So I also wanted to mention the fact that Ernst & Young is here at the institution. They've been here for the last 9-10 weeks, and they're looking at the overall research administration infrastructure, and they're really looking at it from the perspective of the research team, the investigators. How do we provide better support? And I think that it goes to the last question, how do we increase our proficiency? How do we make sure that we're more efficient? How do we make sure we're effective? How do we make sure that we're providing a service to you? And so I think they're really looking hard at that. So that's something, Dr. Lama, that maybe in the future, once the report comes out, you might want to have somebody come and explain what is the plan for the future that will help support the research community.
Definitely, Rob. No, I think there have been, what I see is that there's a very strong, it, you know, there's strong support to do that. Every time I have spoken to any of your research offices, I have never felt that there are, that they are not amenable to change. Everybody is amenable to change with the goal of making it more efficient and providing, support which will enable people to do more. And I think that's the amazing part about it. So you're absolutely right. We will do that. We will, once that happens, invite maybe, this seminar series is going to continue. So hopefully we will address those changes. Thank you. Thank you, Robin. Delta, you want to go ahead? Did you have anything more to present, or are we just only going to do questions now?
We're doing questions now.
Okay.
So yeah. So does anybody else have any questions? You can put them in the chat or feel free to unmute and ask those questions.
Kanika, if you can stop, either Bridget can stop sharing so that we can see each other in the panel. Yes, excellent. Dan, thank you for joining. You always join, and that makes me feel good about having these seminars. Did you have any questions for us?
I do want to add that, so currently on the table, just to let you guys know, definitely those that are investigators on the call. So Dr. David Schuster is doing a letter of support. He's submitting that to Dean Wan. I'm not sure if it's gone out yet, but I know we were working on the review and the edit of it last week. So he will be sending a letter of support for these initiatives that I've talked about as it relates to the combined efforts. So definitely that pilot program that I was just talking about on my last slide. So that was the one that started helping investigators for sure at the time they get ready to start seeing patients. So making sure that, you guys are ready to go, you have support, and someone is following you to make sure that, your finances are together, billing is together. And then if there's any other issues for this queries and things of that nature, we have other people that we work with. You guys may have heard of the clinical trials audit and compliance team. CTAC is who they call them. That's in Stephanie Daraki's group. We work with them very closely to make sure that your study teams get what they need in the field. So there are people there to help you guys. So he's submitting that request on. Hopefully that gets, that support that it needs. But definitely you as investigators, let your dean know this is something that you need and you want it to be supported so we can try to get more resources to help you in this quest.
I would love
that's all I have, Dr.
investigators here who have any questions, who have been running clinical studies. And, I am at this time not running an interventional study myself, although I do, and I have done previously. But if any one of you is running an interventional study and you have any questions, please feel free.
Oh, he says sorry, he's on his phone.
Okay, yeah. I understand that. No, thank you for joining. One of the things which I think is going to be, has been frustrating. There is a question, still brand new, no questions. I will as things go on. Okay, thanks, Byram. One of the things which has always been a concern of mine is when we are budgeting, that budget part, right? Robin, we have discussed that before, which is when I am getting a clinical, I just did that. I did a clinical study. It's not a clinical trial, but I was getting some money from pharma to do some lab research. And I had a really difficult time getting that budget because that budget isn't like a typical budget, what you do for NIH, where you put your effort, right? You have to actually tell them how much the experiments will cost. And it's a very difficult thing. And it's the same thing with clinical trials, that understanding what budget you are asking the pharma to provide you is very important, because you can completely under budget. And this is what we had realized, that our investigators, one, don't put any of their own effort on because they don't have any money to put their effort on. And then they are going in a hole, and then they're doing another study to see if they can dig themselves out of a hole. So As we move forward with this process, and this could be not either under any one of you specifically, and I know that clinical trials is now going under Woodruff under the new system. What do you guys think is the best way for us to provide that support for our investigators? Should we be doing that help at a local level, like it at a divisional level, because we know how much a bronch costs or how much PFTs cost, and anybody who has done a study which involves the respiratory system might know more about it. But any ideas on that? Because I think that still continues to be a struggle, and our investigators don't know how to put their effort on as well.
Got it. So you're asking, if I can reframe what you're asking in terms of the budgeting process, because you need effort on these studies,
So
how
you're
to best
out once the clinical trial has started, right?
once it's
Your,
started.
your goal comes in once the clinical trial has started, and you will help them with the budget after that in a way that, echocardiogram was supposed to be $500, was supposed to be charged for the patient thing, and that isn't coming through or stuff like that. You can help us with that. But I guess I'm going a little bit pre
Yeah,
that.
because it would
Yeah,
be more of a pre thing because you
it
want
will
to
be a pre.
address that on the front end. And we do have some of our pre-award budgeting people on here. So when I talked about earlier about we help them understand, make sure that they understand their coverage analysis after they've gotten awarded, well, that coverage analysis would have happened during the pre-award phase of things. And that's telling us directly, say if it's an EKG, based off of certain criteria for a qualifying clinical trial, will that be payable to insurance, the payer, or the grant?
Yes.
And so our pre-award team will do that analysis to give you a coverage analysis to help you direct how charges will go and who they will go to. And there's a slew of other things involved in that, but they also will aid in developing that budget and negotiating that budget with a sponsor to make sure that we get the proper amount of funds to cover those things. What we will do, so pre-award is going to handle that piece for you, but what we will do on the back end is to make sure that those charges are hit correctly to your grant account. So one, it doesn't cause it to go in a deficit if it went the wrong way. Second, so it doesn't go to the patient if you said it was supposed to be free, so it doesn't hurt the credibility of your study, right? Or upset a patient. And then overall, we want to make sure that you're getting the funding so it's directly credited to your grant account from your sponsor. So we're kind of almost like, I hate to call it like a watchdog, but it's almost like we're really there walking with you to make sure that you get everything that you need on the table. I give you an example of this, and I don't think Dr. Schuster will mind me sharing this story, but we had a study of his where we negotiated for him to be like this person who does all of these meetings in his study. And he does a lot of them, but they are invoiceable items. And he gets paid money for leading these studies. If nobody is paying attention to that or tracking that, that's
Yes,
money left on the table.
absolutely.
So
We
we
put
are
a lot of
paying
money on the
attention.
table like that. Yeah.
So
Yeah.
we're paying attention, and all I told him to do is let me know when you're doing them. I have them in my backhand, and I know the study team is busy, right? They're trying to take care of the patients and do so many other things based off of the disease specialty they're dealing with. So I'm reminding the study team member, hey, Dr. Schuster already did 3 studies, three meetings since this study got open. I need you to go in and invoice so track that information so our invoicing team can make sure we get the funds. And let's just be honest, and I know it's being recorded, but sponsors love when you forget things, right? They love it because that way, yeah, they negotiate it. But if you don't tell them you've done it or you need it, you just left money on the table for what you could have received. So
Bridget,
we're doing a lot of that for
yeah.
you. We also,
I,
so we're doing a lot of those types of things for you guys.
what have you guys done to get feedback? So if this Navigator thing has been going on for quite a few years now, right? Have you sent surveys to studies which were in the Navigator to see if, you know, if people have found the services helpful, or have they utilized that, or have they, like, what I'm trying to ask you is, we need to continuously have the process of feedback and improvement, right? And identifying things which I think you guys are all doing. You guys are all every day identifying, like I love to call micro hurdles. And some are very easily solvable, some are much bigger, which are beyond our pay skills. But some are micro hurdles, what we call them. So have you guys sent out surveys or met with investigators whose studies are in the Navigator and said, you know, I know you're mentioning a few people, and they might be really satisfied customers because they are, like, getting a great care. And but have you reached out to a wider people and tried to identify other areas to help?
Yeah, so before I took this on, so I started in this role with the Georgia CTSA last year. So I've been on it for a year. And so for this past year, me and Delta have been reestablishing, and like I said, we're going to do a road show, because first people need to know that these services are there, right? They don't know that they're there. But I have seen some of the data previously, when it used to be under one of my colleagues. It was part of her responsibility at the time, and they did do surveys, and they did say, I think recently we haven't been getting as much great press about it because they don't understand it. And so they get information and I'm like, we don't know what it is. So what that told me is I need to reintroduce this, hence why we're here today. And we wanted to meet with you guys so people can start knowing about these services. And so you guys can give us the feedback so we can only improve this moving forward.
I absolutely love what you said, Bridget. Thank you, because you're absolutely right. Like I said, part of the issue is, and I face it every day, part of my issue is my lack of awareness, right? If I'm not aware of something, how will I use those services? And the fact that you reached out to us and said, we have this Navigator thing, we would like to come and talk to you, let your people know about that, let the investigators know about that. Kudos to you. No, that's wonderful. I agree with that part. That first thing is knowing, and then is so hopefully, we will pass this on in our newsletter. If I go back and listen to this, or at least again in the newsletter, we can uh, put in a little blurb about what is exactly this service and how people should be utilizing that. And if you can help with that, Bridget, we'll be happy to put that in the newsletter a little bit again, and point people to this ease of research seminar. But also, so that even if they don't want to listen to the whole seminar, they can get
the
the
synopsis of what we're doing,
blurb which we can put in.
Yes.
Do we have any other questions from the panel, from our anybody who is in the audience? All right. John, Robin, do you have anything else to add, or anybody from your team? Bridget?
No, I just say thank you guys for this opportunity to welcome us to let you guys start knowing about these services. You're going to start hearing about them a lot more, because we are planning to do that going to department to department and letting them know about these services so we can help in any way that we can.
Thank you, Bridget. So in the spirit of Friday, we'll give 7 minutes back to everybody.
All right. Have a great weekend, everybody.
And have a good
Bye-bye.